we now come to our second plenary session titled Impact of Climate Change on Mosquito-Borne Diseases. Session again will be moderated by Dr. Inke Nadia Diniyanti Lubis, Doctor of Philosophy from Universitas Sumatera Utara. Without further ado, ladies and gentlemen, please welcome Dr. Inke Nadia Diniyanti Lubis from Universitas Sumatera Utara.
Thank you so much, Mbak Rima, and thank you again for the introduction. I hope that you all enjoyed the first half of the webinar. It's been very exciting. And now we are going to listen to a more exciting topic about the impact of climate change on mosquito-borne diseases by Associate Professor Kimberly Fornace. Dr. Fornace is an Associate Professor and Head of the Climate, Environment and Health Program at the Swee Hock School of Public Health at the National University of Singapore. She was trained in molecular biology and infectious disease epidemiology, and she obtained her Ph.D. from the London School of Hygiene and Tropical Medicine, focusing on the spatial epidemiology of Plasmodium knowlesi in Malaysia. Her research explores how climate change, land use, and ecological dynamics shape the transmission of zoonotic and vector-borne diseases, with extensive fieldwork in Southeast Asia and global collaboration. She is widely recognized for pioneering the integration of Earth observation, remote sensing, and machine learning into public health, and has been invited to speak at major international forums. I would like to welcome Kim to give your presentation. Hi, Kim.
Hi, thanks so much for the introduction and for having me here. It's been really exciting to see all the work that's going on. So I'll just share my screen.
Yes, please.
All right, all good? Okay, great. Well, I thought today maybe I can give a brief overview on the impact of climate change on mosquito-borne diseases. So certainly it was nice to see that this topic came up in the last session as well. So it's something that many of us have been thinking of. So just to kind of set some context, I think we're all very aware that our climate is changing. There's a lot of work that's been done in the region looking at potential scenarios of what our future climate might look like. This, of course, depends very much on the decisions that we make today. So whether we reduce greenhouse gas emissions, whether we continue to increase these, and how we can actually mitigate climate change. But under all the scenarios that we have looked at, we know that we're likely to be facing more frequent and intense heat waves. And we also expect that there will be more frequent extreme El Nino events that we're facing around the region. What this translates down to the ground in reality, which I think many of us are quite familiar with already, is we are starting to deal with more and more frequent floods, storms, and landslides. Certainly, we've had major flooding events within the past week even. Many places are being hit with extreme weather events at increasing frequencies. Of course, we have rising sea levels and all of the challenges that this brings in terms of population movement and displacement. And we're facing heat waves and droughts. So we're really facing these quite extreme changes in our climate. So we do a lot of work on climate-sensitive infectious diseases and thinking about how these changes in the climate actually translate down into impacting the epidemiology of infectious diseases. So these types of events can lead to shifts in seasonality. For example, an outbreak or a season may start earlier or later. It might last for longer than what we would typically expect. We know in many places we're starting to see shifts in geographical range or limits. So there might be areas that previously didn't report malaria that are now starting to report malaria or other vector-borne diseases. And of course, we're starting to see changes in the timing, the intensity, and the duration of outbreaks that are related to these climate changes. Obviously, the focus of the meeting today and also a lot of our work is thinking about vector-borne diseases. So we know that these diseases are highly, highly climate sensitive, and we know that temperature and rainfall directly impact mosquito vectors. So as temperatures warm up, this can actually lead to faster development rates in the insects themselves, as well as in the parasites and viruses that they carry. We also can see that as the temperature increases, when it gets to a certain point, it gets actually too hot for mosquitoes as well. So we see after it reaches a certain threshold, often we see declining survival. And we see similar complex patterns with rainfall, where if there's no rain, we have no mosquitoes. If there's too much rain and flooding, this might wash the larvae away. And we also see the effects of people's behaviors as they try to manage this. So if there's a long drought period, we often have to store water. We may be kind of thinking about how we manage water resources, and this can actually in itself create new habitats for mosquitoes. So a lot of the work that's been done looking at climate change and vector-borne diseases is really looking at the impacts of these changing vector distributions. So where we really see these impacts quite clearly is at these kind of extreme latitudes. So for example, in Europe and North America, where we're starting to see the movement of vector-borne diseases into new areas. And we also see these at different altitudes. So for example, areas that are very high elevation that were previously too cold for mosquitoes are starting to become warm enough to support mosquito habitats. So certainly in the areas that we live in, we're primarily concerned with these changes in altitude and thinking about how these kind of higher elevation areas may be at increased risk. We've done a lot of work as well to start to think about how we incorporate some of these different sources of climate information and can use this to understand what's driving the intensity, the frequency, and these patterns of outbreaks. So to give one example of this, we're working quite a bit on climate and malaria in the Philippines. So this is looking at the island of Palawan. So this island reports 95%, over 95%, maybe close to 100% of the malaria cases for the entire country. And if you look at the malaria cases, they're very strongly clustered down at the south of the island. And we can overlay this with different factors on environmental data. So things like temperature, rainfall, elevation. We can also look at indicators of human settlements like population density. So when you start to kind of break this apart, this is looking at an over 10-year data set across this region. We can see there's big differences spatially. So with certain areas are consistently reporting much higher numbers of malaria cases than other areas. But we do see these seasonal peaks. So there's a certain time every year where we start to see malaria cases, it goes down, it comes back up the next year. And the other thing I think that's really clear is that we see these big interannual variations. So some years we have very high case numbers and some years it's much lower. And so we've been really interested in trying to understand what's driving these different risks. So pulling all this data together in mathematical models, what we can do is start to look at the influence of different factors on malaria risks during this time period. So this is actually a plot that's showing the El Niño index. So this is a sea surface temperature anomaly, which captures whether or not El Niño is happening. And the really interesting thing with this type of work is if you look here in this kind of purple spot here, this is the time when we're facing increased risk. So what we see is about after we start to see an increase in these sea surface temperatures, about 20 weeks later, we see an increase in malaria risks. So this is really useful for us to start to try and understand what would be some of the impacts of changing El Niño events, what would we expect in the future. But the other thing this is really useful for is to think about actually early warning systems. If we can detect something 20 weeks ahead of time, then of course we can think about how do we prepare for it? How do we deploy vector control? And can we use these different sources of climate information to better guide vector control activities? So this is really, some of these models and different tools are forming the basis of many early warning systems. Of course, because I live in Singapore, we can't just talk about malaria. We also do a lot of work on dengue. So this is work that's led not by me, but by others in our group. So looking at trying to fit these same types of models using climate information to actually think about developing a dengue early warning system. So including the temperature, including precipitation, including humidity, also these indicators of El Niño, integrating this with data that Singapore collects on serotype switching. So we can actually think about when the serotypes are likely to switch and how immunity may play a role in this as well. And then this is an early warning system that's used by our kind of agency, the National Environment Agency, to actually plan out their vector control. So the other thing I think these tools can be really useful for is not just thinking about early warning systems, but also thinking about how we evaluate interventions. So I think one of the examples that came up in the previous section that we've been really interested in is if you are deploying Wolbachia and you want to understand the impact of Wolbachia, you of course want to know if you're seeing a decrease in dengue cases because of the intervention, so Wolbachia, or you're seeing a decrease in dengue cases because it's a year where there's not very much rain and the climate conditions aren't suitable. So by fitting these models, what we can do is actually look at counterfactuals. So based on the climate conditions, based on what we know about climate, we can think about how do we understand what is the effect of the intervention and what would this have looked like in these climate conditions without the intervention. We also, I think one thing that we don't think about enough in terms of vector-borne diseases is not just looking at specifically the mosquitoes, but also thinking about some of the wider changes we're seeing due to climate change. So we have very strong evidence that under all of the future scenarios that we're looking at, climate change will increase biodiversity loss. So we expect that there will be major changes to ecosystems as well. We've also seen big effects of climate change and these El Nino events where we have these very long dry periods on deforestation. So certainly in Sabah in Malaysia, where I lived for many years, and other parts of Malaysia and Indonesia, we've seen these huge forest fires that lead to haze and lead to major land use changes. And so many of these also have climate drivers. So as we start to see these increased periods of drought, we're seeing these big changes in forest cover. Another thing we're kind of quite interested at the moment is actually thinking about the converse of this. So we've seen deforestation occur due to climate change. We're also seeing a big effort towards reforestation to actually combat climate change. So here in Singapore, there's a big focus on planting trees. Even in this very small island, Singapore has committed to planting 1 million trees by 2030. So we're trying to make greener spaces to help support kind of some of the climate goals. So the trees can certainly capture climate or capture carbon. So this really kind of addresses some of the worries of climate change. And these can also be really good solutions to think about managing heat and making sure the outdoor environment is kind of suitable for exercise and for other activities. Within many parts of Malaysia and Indonesia where we're working, there's a lot of interest in carbon markets. So people planting trees as they try to kind of offset carbon emissions. And certainly there's a real question as we are planting trees for climate change, how do we make sure we do this in a way that's supporting health goals as well? So we certainly don't want to create more vector breeding sites, but we actually have the opportunity to think about how we can design these land use changes in a way that actually supports health. So when we look at these kind of wider context of the land use changes that are going on in the region, there's a lot of complex interactions with vector-borne diseases. So this is, of course, changing the different habitats of the mosquito vectors. This is changing movements of animals or agricultural patterns. And this is additionally changing the ways that people are using space. So whether people are living in highly urbanized areas, whether people are starting to move into more forested areas, all of these have an impact on vector-borne disease dynamics. I think one of the kind of examples where we've seen this has actually had a massive impact is actually looking at zoonotic malaria. So we've done a lot of work over the years in Malaysia and now increasingly in Indonesia, thinking about the rise of the zoonotic malaria, Plasmodium knowlesi. And we have very, very strong evidence that this is associated with deforestation. So we often see outbreaks where we see increased human cases at the forest edges. And as we're continuing to face these land use changes, and kind of wider ecological changes, there's a real question of how this will shape zoonotic malaria risks in the future. The other area that I think we're starting to increasingly see the impact of climate change on indirectly is the movement of people. The Asia Pacific region has some of the highest migration due to climate reasons. So as we're seeing climate is impacting agricultural practices, this is impacting livelihoods, this may be leading to forest fires or other types of big disturbances, as well as these extreme weather events, flooding, other factors. This leads to a big movement of people. So whether it's movement of people within the same country, movement of people across borders, or kind of for permanent or temporary, we're seeing a huge change in how people are moving across space. We've even seen in many cases around the Pacific region, actually, there's planned relocation. So entire communities are moving in response to sea level rise because these are no longer kind of suitable environments. And certainly there's a huge amount of work that colleagues in Indonesia are leading, thinking about actually what is the impacts of some of the planned relocations of the capital from Jakarta to Kalimantan. So climate is a real big driver for kind of movement and migration of people, and this can expose to people to different risks. So just to kind of put some numbers on this, just as in context, if we look, this is actually data from 2022, but if we look globally at all the climate-related displacements that occurred, you can see that across the Asia-Pacific, we're really the hotspot for where this is happening. So the most people are moving in our area compared to any other area in the world. So this is something that is really a priority for us to address. And so certainly this brings a lot of challenges. So for some of the work we've been doing with the Asia-Pacific Malaria Elimination Network, but thinking even how do you deploy vector control if people are having to move in response to floods or response to other events? How do you make sure everyone has a mosquito net if they're kind of having these mass migration? The other question I think is really interesting to think about is to think not just about climate change, but if we think about specific diseases, when we look at when diseases have resurged, what has driven these resurgences? So there's been quite a lot of work on this done for malaria, thinking about in the past, when we've come very close to eliminating malaria, what has driven a resurgence in malaria? And perhaps unsurprisingly, over 90% of the resurgences in malaria over the past kind of century or so is due to weakened malaria control programs. So often this is due to funding cuts and lack of resources. This can be due to an inability to deploy vector controls measures to high-risk populations. And this can also be due to reallocation of resources to other emergencies. So certainly we saw this during COVID, when COVID really became a priority, then malaria and other vector-borne diseases were less of a focus because the kind of resources and priorities really needed to shift. We've also seen very strong evidence globally that conflict, population movement, and civil disruptions are major drivers of malaria resurgences. So in many cases, we've seen a big spike in malaria after some of these events have happened. And I think why this is important when we think about climate change is we know that climate change is likely going to lead to an increase in some of these different events, whether it's conflict, population movement, or these disruptions to control programs. And it's really worth thinking about actually how do we prepare for that. So along that question, we've been leading a lot of work with the Asia-Pacific Malaria Elimination Network and many other partners thinking about if we know this context of a changing climate, how can vector-borne disease control programs actually adapt? So what is possible to do about this? I think one of the good news and one of the quite positive developments is we have a huge advance in technology. So we have global observations, we have a huge amount of data that's been collected by satellites, work that's been done by climate modelers. So we can actually think about how we use this to direct local interventions to make sure we're timing these to the places and the specific times that need them the most. A lot of our work has been thinking about how do we use some of these new data sources. So we know certainly there's been satellite data that's been available for the past 50 years. We now have new things, which are maybe not so new anymore, but drones and other ways that we can really collect very high resolution data over specific areas. So we have a huge amount of data that we can use to monitor these risks and really think about how we direct control programs and how we understand how these underlying environmental changes are impacting vector-borne disease transmission. The other thing I think that we have increasingly is we have a huge number of new tools that are coming out. These are really changing at an almost kind of daily pace, but we have all of these machine learning and AI approaches we can start to think about analyzing these complex data sets with. So this really creates new opportunities to use these types of data in a way that allows us to really direct kind of different control programs or understand the epidemiology better. And of course, one thing that we have been really interested in is thinking about how do we apply these not just to look at kind of where mosquito habitats or kind of what are these wider environmental or climate changes, but actually how do we collect better data on wildlife, on other animals that we need to understand to really understand changing risks. So this is some examples from work we've done in Malaysia. So looking at actually, can we use thermal imagery? So drone with heat-seeking kind of thermal camera to actually find the monkeys in the forest? And can we fly this over the area to see whether or not we see monkeys roosting in trees so we can rapidly understand what are the wildlife populations in this area? We've been applying some of the same methods with these small acoustic monitors, so these little microphones where we're collecting very short snippets of sound. We're running these through AI algorithms, and we're actually trying to detect what animals are making different sounds, so we understand whether or not an animal is present or absent in a different location. So we're doing some work in Malaysia and Singapore looking at using these for macaques to understand Plasmodium knowlesi transmission. We've also been doing a lot of work with these types of tools to look at other zoonotic diseases like bat-borne diseases. And so a lot of this work that kind of and a lot of the thinking behind some of the work of around climate change and vector-borne diseases has come up from an interest group that I run for the Asia Pacific Malaria Elimination Network on climate and environmental change. So we've been really starting to think about how do we actually understand what are the impacts of climate and other environmental changes on malaria in the Asia Pacific region. We know that we're facing many of the same challenges as the entire world, but there are things that are specifically much more pronounced here. We also want to really think about what are the different ways malaria programs can adapt to this changing environment, whether this is early warning systems, whether this is using satellite and drone data to actually map out changing risks, whether this is thinking about kind of policies or kind of financing to actually support climate change adaptation and to better link health programs with the meteorological surfaces in countries and within the region. And finally, we're also thinking about what are some of the opportunities to mitigate these climate and environmental changes. So are there sustainable development practices that we could actually use that might have benefits to malaria control as well? So with that, I think I'll end there, but thank you very much. And thank you again for inviting me. If the kind of topic is of interest, we do run a number of different events through ATMEN, but please feel free to reach out to me as well.
Thank you so much, Kim, for a very interesting topic. And we understand that climate change is a very big issue at the moment. And us, especially like Indonesia is part of the archipelago, we have higher risk for so many natural disasters that could impact the transmission of different vector-borne diseases. Is there any question from the audience? And can the committee please share the slide deck, please? Yes, so we have several questions. So the first one is from Dodi. How does the Wolbachia mosquito develop in response to changes in temperature and rainfall? Is there any further observation?
This is a really good question because I saw this come up with the last one and I was thinking, actually, I don't know the answer. Certainly all mosquitoes, as temperatures increase, mosquitoes will develop faster at higher temperatures up to a certain point. Yeah, I'm actually not aware of any studies that have specifically looked at the impacts of temperature and rainfall on Wolbachia mosquitoes. So I think it's a really important topic. So I'm afraid I can't answer that, but it's a good question to go away with.
Yeah, especially now, Wolbachia mosquito is very promising, and but we need to understand more with the changing climate that is happening. And the next one is regarding deforestation. We may not know much about reforestation programs, but what do we know often relates to politics and economics that regulate deforestation? What are the other alternative solutions that could address this issue?
I think this is something we've been really interested in. And I know there's some other groups in SABA that have been working on this as well. So we've been looking across different sites if we can monitor the vector distributions across areas that are being reforested. So for example, somewhere that's planting trees now, somewhere that's planted trees 5 years ago, 10 years ago, 20 years ago. And at least for malaria and anopheles, we do see as the forest gets older, we actually see a decrease in the mosquito density. So this could be a really kind of positive thing if we could think about how to do that. In my mind, I think there's kind of two sides to this. So I think we shouldn't stop reforestation. I think there's a lot of benefits to reforestation. But we should be very aware that if there's certain risks, we need to have the surveillance systems in place that can actually detect whether there's changes in tree cover and think about how, if there's specific populations living near here, these areas, how do we actually deploy vector control? So I think long-term, it could be a really positive thing for many vector-borne diseases, but there's a need to kind of collect the data that allows us to monitor it.
Thanks, Kim. And the last question, I'm not sure if this one is intended to you because this is about the Wolbachia program. Is there any strong evidence of specific population characteristics that are particularly helpful for the program spreading? And additionally, can Wolbachia program be conducted throughout the year, or are there specific months when it is more appropriate? Would you like to respond to this one?
Yeah, the first one I think I'm probably can't respond to. I could definitely, if you want to send me an email, I can direct you to the people at NEA who can respond, or I'm sure Indra will know as well. But for the second one, a lot of the work that's being done here in Singapore is actually thinking about kind of where and when do you target things. So I think there is a real opportunity to use some of the climate data to think about, when do you actually deploy this, when it's the most effective, and then kind of how do you actually monitor this? So I think there is a real role in thinking about when you have these increased risks.
I actually have one question for you, Kim. So we know that, especially after your presentation, that the interaction between climate change and vector-borne diseases are actually very complex and also not very straightforward, that increased temperature are not always related to increased population of mosquitoes, but can also has the positive impact. So how would you say the different impact to the Anopheles mosquito and to Aedes mosquitoes of these changes? And how do you also know like how the changing temperature would impact the pathogens such as like the Plasmodium parasite or the dengue virus?
Good question. So the kind of general trends are the same across the different species. So the kind of temperature increases up to, development increases in response to temperature up to a point, and then it becomes too hot. But the specifics for each species, I think, are slightly different. So there have been some studies that have been done in laboratory settings looking at actually how do different species respond to temperature. So it wouldn't be kind of, you see exactly the same for Anopheles and Aedes. It would be very different in different settings. And I think the other thing that's really important to actually think about is the effects of the local land use and microclimate. So we know even if the climate temperature is one, if we have one temperature in the air temperature more broadly, we'll have places that are very hot where you have lots of concrete, or places under trees that could be colder. And so the actual temperatures that the mosquitoes are experiencing is quite different in those different settings.
And how about the impact on the pathogens?
On the pathogens, there's been some work that shows that the pathogen development rate increases as well. So both for dengue and Plasmodium. I actually don't know if there's any work that's been done on Plasmodium knowlesi or some of the other ones that we work on in the region. Maybe others know better than me, but in theory that they increase with increasing temperatures as well.
Okay. I think we still have like 5 minutes left. Okay, if there is no more question, is there any more questions from the Q&A? Okay, so yeah, in Indonesia, malaria medication is only available in endemic areas. However, migration occurs, and what would be the solution for this?
Yeah, I think this is a really important point, and I think it's something that everyone is kind of struggling with now, is that when you have a big movement of people, if it's a planned movement, then of course you can think about how you actually design surveillance, make sure that there's medications in place, that you can detect anyone who may be kind of coming in with an infection. It becomes a lot trickier when you have a mass movement of people in terms of if there's an extreme weather event or a natural disaster, obviously the priority is getting people out of the kind of immediate harm. And so then there's a real need to think about what do you have in place actually after that event happens. So we're working a lot at the moment with Pakistan to think about what does that look like. So not just they've had kind of huge flooding events, but not just the immediate flooding events, but how do you design a control program that deals with the fact that after the flooding events, you have this movement of people coming from different areas. They may have malaria. They probably don't have access to vector control. They might not have access to medication. So how do you plan for that? What do you need in terms of a stockpile? How do you respond? I think they're all really important questions to think about.
Okay. I think we have a raised hand from Pak Asik. Asik, would you like to raise any questions? Very short one, Pak Asik. We only have 4 minutes left.
Sorry, you can hear me?
Yes.
Okay. Thank you so much for your presentation, Kimberly. I think this really make us dear Bradley. And I see that you have a lot of give a lot of fact actually, but for the numbers, the cases, the numbers increasing in the world, like the malaria or dengue. I know that now is look like the booming, but we see in another way also, because we also have a kind of the modeling, especially for the malaria, even in dengue. So we still really underreporting actually. Even for the malaria, we have double actually from modeling that we still have half that we can still capture with the program. And dengue, of course, dengue we see about just only 2% of the data that we capture from the modeling. So I know that now, I think the system is going well, right? Surveillance is okay, and then the logistic and of course the mobilization participation something that is increased. So I think this is also because our system also this good one. It's not just only for the climate change. I know that one. I know that one. But do you have any kind of the view which is the I mean, yeah, I know we want to not to limit it for the uh, for the natural something like that one that's regulated by the climate change or whatever something like that one. But I think our system is also now is increased for the surveillance, especially logistics also and community participation. So I think this is really good for us to comparing what you are dealing with presenting with another factor. So this is for, that we would like from your view. Thank you.
Excellent. No, thanks for a really good question. I think it really highlights some of the complexity of climate. So obviously climate is not happening in isolation. It's not something that just happens by itself. There's also this kind of wider surveillance system that's in place. And I think they're quite important. So climate can have a big impact on actually how well your surveillance system is detecting cases. So, if the road is flooded, you're not going to the clinic to report, and kind of all of these different factors. So they do interact quite closely. I think it's really important to think about linking them together. So not just looking at kind of climate change in isolation, but also thinking about how do you kind of develop a really good surveillance system where where are you really reporting the cases, and are there areas where you're not reporting them and you're not detecting them? So certainly for any of the kind of climate models, if you're relying on reported case data, you're also relying on data that we know is incomplete. So you may see general trends, but this is not everything. So those two, I think, really need to go hand in hand. And I think that's quite an important point.
Thanks so much, Kim. And I think, we have reached the end of the session. Please give big applause to Dr. Kimberly Fornace. And thank you so much again for sharing this insightful information. Not only that we need to understand more about the climate change and how it would impact the vector-borne diseases, but how can we also use this climatic information as an early warning system to to detect early of potential outbreaks and expansion of diseases. Thank you so much again, and I will give this back to Rima. Thank you, Kim.